Hello, everyone. Welcome to Vaccinate Your Family's 2021 immunization webinar for WIC staff. I'm so glad that everyone can make it today, and we hope that we will give you a lot of great information that you can use well into the future. So joining me today from Vaccinate Your Family is Carly Dara, and she's going to help us run this Zoom today. Next slide, please. For those of you who are not too familiar with Vaccinate Your Family, I just wanted to let you know a little bit more about us. We are a national nonprofit organization, and we're headquartered in Washington, D.C., and we're currently celebrating our 30th anniversary this year, which I'm glad to report. And our organization was started by Rosalind Carter, former First Lady of the U.S., and former First Lady of Arkansas, Betty Bumpers. And our mission is to protect people of all ages from vaccine preventable diseases. And you can see some of the ways that we do that by looking at the screen. Next slide, please. And I wanted to just take this one opportunity to thank you all for everything you do. We really appreciate WIC, and we really appreciate everything you do to help keep children up to date on their immunizations, and everything you do to help answer people's questions about vaccines and help promote vaccines for pregnant people and children. So just wanted to make sure I got that out there in the very beginning. Next slide, please. So this slide just talks about some of the resources that we have specifically for WIC staff and WIC participants. Obviously, the first one is this annual immunization webinar, and our webinars are recorded, and the recording will become available, and I'll make sure everyone has the link. You could also find resources for WIC staff if you look under vaccine resources on our website. And if you pull down the pull-down menu, you'll see WIC staff is listed as one of the options. And if you click that, it'll be easy to find everything you're looking for. Another resource we have is the immunization resources for parents and parents-to-be in both English and Spanish. And normally we give this, this document out to everyone right at the webinar. But because of some changes that are quickly happening, particularly with children and the COVID vaccine, we wanted to make sure you had the most up-to-date information. So this 2021 version will be sent to you. A link will be sent to everyone who was on the webinar in the very near future, probably the next few weeks. And then we also have information for WIC staff, our Vaccines 101. And again, the 2021 version is coming soon, and we will send links. Next slide, please. We also have some child and teen vaccine preventable diseases ebooks and booklets that you can find on our website. And some of you may have seen this from us before. We've recently updated, but it's basically an easy to understand description of all the vaccine preventable diseases and just a little bit about the vaccines that are available to prevent those diseases. We also have it for adults, and everything's in English and Spanish. And then we also have something called How to Pay for Your Family's Vaccinations. This is new. It's an online tool that we have, and you just have to answer a few questions about your health insurance status, and it's anonymous, and you can easily find out how to get your children's vaccines and not have to worry about paying for them. Next slide, please. This is just to remind you that there is a vaccine lesson in English and Spanish for WIC participants directly, available on wichealth.org. And we launched this lesson in March 2020. And as of the end of September 21, we've had about 38,000 vaccine lessons completed. Most of them in English, but some in Spanish as well. If anyone is interested in making sure that this lesson is available for their participants, please contact Kimbra Quinn, and you can see her email address in this slide. Next slide, please. And I just wanted to quickly highlight just a few pages on our website for when you're looking. We have our pregnancy page on our website, which has vaccine information before, during, and after pregnancy. Next slide. This one is vaccine information for babies and children, and it includes links to recommended immunization schedules. Next slide, please. This is our new COVID-19 FAQ page, and we've been doing our best to keep it up to date with everything that is constantly changing regarding COVID vaccinations. So I just wanted to highlight this page so you can find answers to your questions. And we also have a new graphic about, do I need a COVID-19 booster shot? Because we know that is super confusing. And so we created this, this graphic that you're welcome to use, and I'm going to send it to everyone, but we thought it would be helpful to know whether or not you need a booster dose. Next slide. And I also just wanted to highlight that we now have pages in Spanish, and you can get there going onto our website /en español. And we created them not just translating the information, but making it culturally competent. So I think it's a really good resource for your Spanish speaking WIC clients. Next slide. And we hope you will follow us on social, on Facebook, Twitter, Instagram, YouTube. We also have a Shot of Prevention blog, and you can find all of the information on this slide. Next slide. So now I would just like to introduce Valerie Soto, and she is from the Supplemental Foods Program Division at USDA's Food and Nutrition Service. And Valerie, please give your remarks.
Hey, yes, thank you. Thank you everyone for joining us today. We are very grateful to Vaccinate Your Family and CDC for their partnership and for presenting this webinar to update all of us in WIC about vaccines. Educating WIC participants about the importance of vaccines and providing referrals to immunization services has been a part of WIC efforts since the inception of the WIC program. And since WIC comes into contact not only with WIC participants, but also with caregivers, parents, siblings, and other friends and family, WIC is in a unique position to disseminate the information about why immunization is critical in ensuring good health. WIC has a helping role by encouraging parents to bring their infant and child's immunization record to WIC appointments so that WIC staff can screen the record as part of the WIC certification process and provide a referral as appropriate. And as a result of all of these efforts in WIC, the childhood immunization rates among participants have increasingly improved over the years. We've made educational materials and immunization information resources available for WIC staff on the WIC Works resource system, including our minimum screening and referral protocol and links to the Vaccinate Your Family website that were already shared. So today's webinar will be especially helpful in raising awareness and answering questions that you may have. We encourage you to share this information not only with WIC participants, but with friends, colleagues, neighbors, and family as well. Thank you for your attention.
Thank you so much, Valerie. Next, we have Darlena Birch. She is from the National WIC Association and just wants to give a few remarks and a welcome. Darlena?
Thank you so much. Good afternoon, everyone. My name is Darlena Birch, Senior Manager of Public Health Nutrition at the National WIC Association. It's my honor to welcome you to this important webinar that discusses the vital role that vaccinations play in ensuring the health and well-being of the public. As the premier public health nutrition program, WIC is instrumental in not only providing nutrition education, breastfeeding support, and supplemental foods to participants, but WIC also provides referrals to health and social services, including vaccination referrals. Given that access to vaccinations are also an important aspect of public health, WIC staff play an important role in making sure participants are aware of their own vaccination needs. Not only do vaccinations improve the health of the program participants and the public at large, but they also reduce health equity issues. As the nonprofit voice of the 12,000 public health nutrition service provider agencies and the over 6.3 million mothers, babies, and young children served by the WIC program, NWA provides education, guidance, and support to WIC staff and drives innovation and advocacy to strengthen WIC as we work toward a nation of healthier families. NWA values our partnership with Vaccinate Your Family and USDA's Food and Nutrition Service on this important issue. Thank you so much for allowing me to speak.
Thank you so much, Darlena. Appreciate it. Next slide, please. So before I move on and introduce our guest main speaker for today, I just wanted to do a quick polling question. So let me just put that up there. And if everyone wouldn't mind answering this, the question is, after participating, or nope, sorry, wrong poll. 1 second, one moment, I apologize. Whoops, why am I not able to pull the right one up? There we go. Okay, sorry. First question is, I feel comfortable being a source of vaccine information for my WIC clients or participants. And if you could just answer strongly agree, you somewhat agree, you're neutral about it, somewhat disagree, strongly disagree, or this is not applicable to you as you don't deal directly with people who are WIC participants. If everyone could click. Oh, is not everyone seeing the poll? Oh no, that's not good. Okay, Carly, now we got it. Hopefully everyone could see it now. I apologize for that little technical glitch. The people are now answering. Give it another few seconds. Great. Thank you so much, everyone. I appreciate it. And I apologize. I see some people aren't seeing the poll. I'm not quite sure why. So I'm sorry about that, but there'll be another 2 questions at the very end that if you could hopefully see the poll and answer them, that'd be great. Okay. All right. So thank you, Carly. So next, I am so happy to introduce Dr. Sarah Mbaeyi, who is from the National Center for Immunization and Respiratory Diseases at Centers for Disease Control and Prevention at CDC. And as you all know, CDC has been extremely busy over the last year trying to deal with COVID and come up with recommendations to help protect all of us from the scary COVID. So Dr. Sarah Mbaeyi, is a medical officer in the National Center for Immunizations and Respiratory Diseases at CDC. She is also a board certified pediatrician who completed her residency at Boston Children's Hospital and Boston Medical Center, as well as CDC's Epidemic Intelligence Service Fellowship. She has worked both domestically and globally on vaccine preventable diseases and vaccines, including work related to surveillance, outbreaks, vaccine confidence, and policy. She has also held numerous leadership roles in CDC's COVID-19 vaccine task force, including leading vaccine policy and clinical guidelines development, serving as chief medical officer, and most recently serving as senior advisor. And now I am so happy to introduce Dr. Mbaeyi. Please, let's move forward with the presentation.
Hey, thank you so much for that introduction, and thank you so much for having me here today. I'm really happy to be able to speak to this group and kind of give you some more information that will help you in working with your patients and making sure that they're all up to date on their vaccines and know where to go and how to get the vaccines they need. Next slide. So let's just start with a little bit more about why we're here today. Why is it so important for us to be talking about vaccines? And this is because we've seen just how impactful they can be. CDC did a study that estimated for children born between 1994 and 2018, we will be preventing 419 million illnesses, which is more than our US population total. This includes prevention of about 27 million hospitalizations. We'll help to avoid almost 1 million deaths. And we will save almost $2 trillion in societal costs. So that's more than $5,000 for each American. So we know how important vaccines are, and we know just how many lives they can save. Next slide. But unfortunately, we've seen that with the COVID-19 pandemic, we've seen a lot of declines in pediatric vaccination uptake. And we've seen larger declines for some vaccines more than others. So I think fortunately for this group, the vaccines given to the youngest of children, those have the smallest gaps in terms of where we would expect to see for coverage. So for rotavirus vaccine, we're still down about 6% compared to what we were before the pandemic in terms of percent of children getting vaccinated. For pneumococcal vaccine, we're down about 8%. And for the DTaP containing vaccines, we're also down about 8%. It is, the gaps are much higher for our adolescent patients, unfortunately. So for Tdap, we're down about 14%. HPV around 17%, and for meningococcal vaccine around 10%. But I do want to point out for measles containing vaccine, we're down about 16%. And this is really kind of scary actually, because we know that with measles containing vaccine, we really need really high coverage in the population to prevent outbreaks. I know people remember probably a few years ago, we were having a lot of outbreaks in the US due to measles. And so it's very concerning that we're down in our vaccination around measles. So that's one, I think, for us all to really pay attention to get that coverage back up, especially. Next slide. So let's talk a little bit more about the disease, some of these diseases in more detail. So for whooping cough and or otherwise known as pertussis, this is a highly contagious respiratory disease that is most dangerous for infants. So the youngest of babies are the ones that are most at risk for dying. So we're talking about 2-month-old, 4-month-olds. The very newest babies are the ones that are at greatest risk. Early signs and symptoms of whooping cough include runny nose, mild or occasional cough, apnea, which is a pause in breathing in babies. So a lot of the early signs look like, a regular cold outside of, apnea, which is where babies kind of stop breathing momentarily. But the later stage signs, include, fits of rapid coughing, followed by a high-pitched whoop and vomiting after the coughing fits. And, what we've learned from research is that immediate family members, mom, dad, brother, sister, were the ones that were spreading it to the babies the most. So 6 to 7 out of every 10 babies who got whooping cough got it from one of their immediate family members, which is why it's really important, which we'll get to, is not only to start vaccinating our babies as soon as they're eligible, but to make sure that other family members are also up to date on their whooping cough vaccine, including mom during her pregnancy, but we'll get into all that. Next slide. So just to show you visually kind of what's been going on with pertussis over the last decade or so. So before vaccination was implemented, which you can see by that first arrow, DTP, which was kind of our first version of the vaccine against pertussis, we had a lot of cases, hundreds of thousands of cases, which is probably an underestimate, but hundreds of thousands of cases of pertussis each year in the US. Once we introduced the vaccines, you can see that cases went way down. Now you can see that in the late 90s, we switched the formulation of the vaccines that we used from a whole cell where the whole bacteria is kind of killed and put into a vaccine, where we, had a new version of the vaccine, which was, kind of just using a few different proteins in the vaccine. You can see that we have had a slight rise in cases over the past, decade or so. So it's definitely something that we're keeping an eye on, but I think, again, reinforces that really the best way for us to protect ourselves and our family members is to get vaccinated. That's our very best tool, because we really need to get high coverage high enough that we can kind of keep these cases down. Next slide. And as I mentioned kind of earlier, most whooping cough deaths are in early infancy. So you can see here, actually what's shown here on the figure is not deaths. We're not having that many deaths a year, but for cases per 100,000 population of actual cases, you can see that it's highest in infants. That's the majority of the cases that we're seeing, followed by the younger kids, and it's adults. It's much more common that we're picking up cases of this, though they are occurring. But deaths, as I mentioned, are they're the highest in young infants, especially the youngest infants. Next slide. So let's talk a little bit more about vaccination and who should get vaccinated. Vaccination is recommended, essentially for everyone, and we just get it at different times in our lifetime. So for infants and children, they get the DTaP vaccine, and they get a dose at 2, 4, 6 months of age, another dose at 15 to 18 months of age, and then another dose between 4 to 6 years of age. So for the, before kids go to school and start kindergarten, we're really looking for them to have gotten 4 doses of the vaccine, and then, another dose before they head off, to school. Adolescents are also recommended to receive a dose of the Tdap vaccine at 11 to 12 years of age. And then for anyone that didn't get the vaccine as an adolescent, so if they're an adult, maybe they were, that recommendation wasn't in place when they were a teenager, and now they're going to their doctor, they're also recommended to get a dose of the Tdap vaccine, to have at least one while they're an adult. And then pregnant women are recommended to get Tdap vaccine during every single pregnancy, and that is to protect the baby against whooping cough, since we know that the youngest babies are at most risk of getting, having severe outcomes and death from whooping cough. And we also know, that these vaccines are very safe, to use during pregnancy. And we've seen a lot of data that show that babies who are born and their mother did get the vaccine during pregnancy, they are much less likely to get pertussis, as well as get hospitalized for pertussis and to die from pertussis. So we have a lot of evidence now that this getting the vaccine during pregnancy is really important to protect the babies once they're born. Next slide. So let's switch gears now and talk a little bit about influenza disease, another really important disease to protect both mom and baby from. So we all know this is a very contagious respiratory disease. The signs and symptoms include fever, cough, sore throat, runny nose, muscle or body aches, headache, fatigue, vomiting and diarrhea can also happen sometimes. But we know that this really kind of fluctuates from year to year in terms of if we're having a bad flu season, a relatively light flu season. But the thing is we never really know in advance how bad a flu season is going to be. So we really need to protect ourselves early in the flu season so that we are protected and the children are protected, regardless of what happens during that year. So for example, in 2017 and 2018, this was considered a high severity season with widespread activity across the United States. We were breaking records for hospitalization rates. We had 188 children unfortunately die from flu, which is the most we've seen since the H1N1 pandemic in 2009. And the majority, 75 to 80% of those children who died were not vaccinated. In contrast, last year during our flu season, this was very unusual flu season in that we hardly saw any disease, both here in the US. We had one pediatric death, but there's probably many reasons for this. But last flu season we were doing lockdowns for COVID. Schools were closed. There were a lot of mitigation measures put in place for COVID to help contain COVID. That masks, we were wearing masks, all of those things likely contributed to the decline in flu incidence last year as well. I think this year we're concerned because we know that things have opened up more, people are getting out more, schools are back in session, kids are in daycare. We saw over the summer that diseases like RSV that we normally see in babies and children during the winter season, we were seeing in the summer because, there were a lot of kids that weren't exposed to these illnesses last year when they normally would have. And so that circulation has started earlier. And so I think we're concerned that, we need to really make sure we're prepared for this flu season for the same reasons. Next slide. So just a little bit more, about pediatric deaths for the last couple of years. We don't want to see any child die of influenza. This is preventable. Even if somebody gets the vaccine and, they still get disease, unfortunately, if they're vaccinated, they are much less likely to die or end up in the hospital, end up in the ICU, those kinds of things. So just to reinforce that we really need, go ahead, next slide, vaccination to prevent severe disease. So our recommendations for flu vaccination, very important to get an annual flu vaccine this year and every year to protect yourself, your loved ones, your community, especially for people who are at higher risk of developing severe flu complications. This is really people of any age with a chronic health condition like a breathing or lung problem, health disease, weakened immune system, but other people are at higher risk of serious complications, including pregnant women, people older than 65 years, and children younger than 5 years. And so CDC recommends that all people aged 6 months and older get vaccinated against flu by the end of October. So we're coming up on that now. But even if you come across families where they haven't gotten vaccinated yet, it's not too late. It's not too late after October. October is just the optimal time to get vaccinated to kind of make sure you're protected before we start seeing a lot of flu activity. Next slide. So some specific guidance around flu vaccination for this year. Children, there are children who need 2 doses of the flu vaccine. That includes anyone aged 6 months through 8 years of age who have either never been vaccinated or who have not received at least 2 doses before, or who they don't know if they've been vaccinated or not. They should receive their first dose as soon as possible. We get a lot of questions about timing, should I get it early in the season or later in the season, or, those kinds of things. So, what we're trying to say is, those children who need the 2 doses, get the first dose as soon as possible. That also applies to children who need 1 dose. We still say get the vaccine as soon as it's available. And pregnant women during influenza, as I mentioned before, they should be immunized. There's no, we don't try to wait for a certain point in your pregnancy to get the vaccine, get it during the influenza season. Pregnant women are at high risk for getting hospitalized or dying, compared to other populations as well. Okay, go ahead. Next slide. All right, so we've kind of gone through this, why it's so important to get influenza. But just a reminder, the flu shot cannot give you the flu. People can get some symptoms after getting their flu shot, like feeling achy or tired or things like that. But it cannot give you the influenza. And so flu vaccines that are injectable or given with a needle, they're made either with flu vaccine viruses that are inactivated, meaning that they're not infectious at all, or with no, I think I should say influenza virus at all. So it's kind of these pieces or proteins that are meant to trick the body into thinking they got the flu without giving it to a patient. Next slide. So we need your help. We know that immunization rates always kind of lag for influenza compared to some of our other vaccines. And, it is a yearly, we need to do this every year. And I know people sometimes get tired of it, or, I got the flu anyway, so why do I need to get a flu shot? I think your help in educating the patients and families, answering their questions, not just for influenza, but for all, of our pediatric vaccines. Let pregnant women know about flu and whooping cough vaccines. Sometimes when we do surveys and trying to find out why pregnant women didn't get the vaccine, it's a lot of times we hear they didn't know. Nobody mentioned it to them. Their doctor never told them. So I think, anything you can do to encourage that is going to really help. Next slide. I think when you get the slides, I think there was a link down here. I won't go through this in detail. This is the vaccination schedule for birth through 6 years of age. It's a parent or family friendly version. So it's things that, this is something you can hang up or give out or include in your materials so that parents know when their child is due for a vaccine, to make sure they go to their pediatrician, they know what to expect, they can get their questions answered beforehand and things like that. Next slide. So one quick way, when the parent will bring in their, vaccination record, and, one quick way to tell if a child is up to date without having to go through each, vaccine and that kind of thing, is whether to assess whether they've gotten their 4th DTaP dose or not at 15 to 18 months of age. If they haven't gotten that dose, that means they're, behind on that vaccine and potentially behind on other vaccines that they would have needed as well. And if they are, if it does seem like they're behind on their vaccines, make sure to let the parent know to schedule an appointment with their healthcare provider. And consider doing, going beyond this. A survey, a WIC survey showed that nearly half of WIC staff review the full childhood immunization record, which is amazing. That is great. Keep doing that and encourage your staff to do that, and provide them the tools to be able to do that. And check to make sure they've received their annual flu vaccine, their measles shot, and other recommended vaccines. And again, refer them if they haven't been up to date on their vaccines. Next slide. So again, quick ways to tell if somebody's up to date. Let's talk about whooping cough. But again, a lot of other, several other vaccines are given at the same time as whooping cough vaccine. So it's a quick way to see just in general how they're doing. So from birth through 1 month of age, babies don't get any whooping cough vaccines that young. By 3 months of age, they should have had 1 dose. By 5 months, 2 doses. By 7 months, 3 doses, and by 19 months, 4 doses. And for pregnant women, it's 1 time during each pregnancy. Next slide. So for flu, I'm going to try to go through this quickly. I want us to have time for questions, but I kind of mentioned that there are some children that need 2 versus 1, depending on what they've gotten in previous seasons. And then for pregnant women, 1 dose during any trimester for women who will be pregnant during the influenza season. Just to note that it takes about 2 weeks after vaccination for the body's immune response to respond and be protected. And so that's why we say try to get your shot during October so that you're protected when we typically start to see rates of flu tick up. But even if a patient hasn't gotten it, let's say it's December, January, later, still talk to them about seeing their doctor to get their flu shot, or pharmacy or wherever they go to get it. Next slide. And then, are you up to date? Think about yourself as a staff member, in terms of your flu, Tdap, HPV, zoster, pneumococcal, depending on what's recommended for your age. Make sure you're up to date to protect yourself, and so that you are, equipped to know about these vaccines and to know what to expect when you get them, so that you can help other parents know what to expect as well. Next slide. So let's talk about COVID vaccination before we kind of wrap up for today. Next slide. So we recommend COVID-19 vaccination for everyone 12 years and older in the United States. For people 16 and older, this is, FDA has issued a full approval. It's gone through all the process that any other vaccine would have to be approved for use. We do have still some emergency use authorizations for other groups. So for the adolescents, for Pfizer, Moderna for people 18 years of age and older, and Janssen or Johnson & Johnson vaccine for people 18 years of age and older. Next slide. So in terms of for pregnant or breastfeeding women, pregnant and recently pregnant people are more likely to get severely ill with COVID-19 compared with non-pregnant people. And we have now a lot of evidence that has accrued over the hundreds of millions of people and overall in the population who have gotten vaccinated to show how safe and effective the vaccine are. And we also have a lot of evidence that has accrued to show just how effective and safe the vaccines are in pregnant women as well. And so we do recommend strongly that COVID-19 vaccination be given to all people 12 years in age and older, including pregnant or lactating people. Just to point out, there has been a rare side effect with the Johnson & Johnson vaccine, the rare clotting disorder. So we just, pregnant women can still get this vaccine, but we do suggest that they're aware, be made aware of these risks and that there are, other vaccine options out there such as Pfizer or Moderna for which that side effect hasn't been seen. Next slide. We also just did come out with some recommendations about additional, as well as booster doses for people who might need them, immunocompromised, and booster doses for other groups of people, which I don't think we'll get into here, but I can answer questions. Next slide. So just to reiterate, COVID vaccines are safe and effective. The safety monitoring that is being undertaken for COVID vaccines is the most intensive and comprehensive safety monitoring in our US history for any vaccine. All of these vaccines have been carefully evaluated in clinical trials, and they've been authorized or approved because the benefits outweigh the risks. And they can help protect you, your patients, their family members, especially for those that are at increased risk for severe illness. And we don't, I think people have probably heard that the advisory committee to FDA did vote to recommend that children as young as 5 years of age be eligible for a vaccine. So that's kind of the breaking news right now. FDA is reviewing and they'll make their authorization hopefully soon. CDC's advisory committee is meeting next week about this. So young, children over the age of 5 may, we'll see, be able to receive the vaccine in the coming weeks. But for those younger than 5, they really rely on the people around them to not get sick, to be protected. So parents, family members, teachers, everybody, it's very important that everybody else get protected to protect those who can't get vaccinated yet, young children. Next slide. I already kind of mentioned this, but safety, the COVID-19 vaccines have been held to the same safety standards. And as I mentioned, all that monitoring has even been increased for these vaccines. And we have some more information about that at the bottom of our screen. Next slide. So just to kind of show you some resources that we have available for COVID-19, and I think it maybe is showing for other people on my screen. I can't see the links at the bottom, but they will be available in the slide deck. Different resources we have around COVID vaccines. Next slide. We have many resources. So Vaccinate Your Family has a lot of amazing resources that everybody should check out. CDC also has some resources as well in terms of talking to parents about vaccines for their children and for themselves. Next slide. We have including resources that are very parent friendly. So we have resources for healthcare providers and other staff, but for things to actually give out to your patients, there's a lot of resources from Vaccinate Your Family as well as CDC. Next slide. And I mentioned the healthcare providers, but also some specifically for pregnant women. Next slide. And we kind of talked about today, vaccines are for people of all ages, from babies to older people. So definitely check out the resources that we have for, depending on who you're talking to and what their needs are, there's resources to kind of address them. And I think that's it. Thank you.
Thank you so much. That was a great presentation. Very, very helpful for me as well. And there are some questions that have come in that I was going to ask you. If anyone has any questions, please feel free to put it in the question and answer section, the panel on your screen. And if we don't get to your question, I will send you an email with an answer to your question after the webinar. Okay, so first question. What about people who work with infants? Should they be vaccinated?
Yes, I'm assuming the question is about COVID, though. I think it applies, or flu, it applies to everything. I mean, I think, people who are working with young children, if there's a vaccine that's recommended for you based on your age or occupation or things like that, absolutely. So if, all of our routine vaccines, or adult vaccines, yes, absolutely. Influenza and COVID in particular are very important right now. Like I mentioned, young children and infants cannot be vaccinated against COVID at this time. So protecting everybody who around them will, hopefully help to protect them too. Same with influenza. Children, babies younger than the age of 6 months cannot get any influenza vaccines yet. So we really need people, to, kind of cocoon around them to protect them. And this really goes for everything, whooping cough, making sure babies can start to get vaccinated as young as 2 months of age. But even one dose can help prevent them from dying. But the full immunity, kind of takes a few doses to kick in. So, all of the diseases all of the vaccines that you are recommended to receive, definitely get them, because those will help protect those around you, including young infants, if you're taking care of them.
Great, thank you. Another question that came in is, why is the hepatitis B vaccine given at birth?
Great question. There are a number of reasons for that. So, hepatitis, before we had vaccines for hepatitis, I don't have the numbers off the top of my head, but there were a lot of babies being born with hepatitis, either through being infected through their mothers, but also there were a high proportion of babies who had hepatitis B who their mother didn't have it, and no one had any idea where the baby got hepatitis B from, whether it was from some sort of contact with another family member, or so there's even if the mother was negative against hepatitis B and couldn't transmit it to the baby that way, there were babies being born that were getting hepatitis B, and it was not clear how they could have gotten that. So to kind of help protect babies, the recommendation was to start giving it at birth, to make sure that, because there's no reason for any child or adult to get hepatitis B anymore in this day and age of highly effective vaccines. So it used to be recommended, the recommendation used to be kind of, give it at birth, but, it can wait if the parent wants, or, it's not, it wasn't a very strong recommendation. Now it's a much stronger recommendation. And we hope that hospitals will kind of implement it as part of their systems, to make it very routine that a baby, is offered, the parent is offered vaccine at birth, to really prevent any baby from slipping through the crack and getting a horrible disease that they don't need to get, and that no baby should get.
Great, thank you. Next question. Are there any studies that show the vaccines are found in breast milk? And I'm assuming this is any of the vaccines that pregnant people are recommended to get, flu, COVID, or Tdap.
Yeah, so there are there is evidence, not necessarily, I'm not aware of anything specifically about, vaccine being found in the breast milk in terms of live or, for live viruses or things like that. I'm not an expert in that area, but I know that we have been seeing that antibodies produced by the vaccine in some cases can be found in breast milk. And I know that that has been the case for COVID. Whether or not that translates to any sort of protection, I'm not aware. I don't personally know the data behind that. But I think, importantly, what we've seen, for pregnant women who, I think it just goes back to the importance of pregnant women getting vaccinated in terms of protecting themselves, protecting their babies. But I can look into it and check with our experts about kind of a little bit more into, how that relates to COVID vaccines and other vaccines in terms of production of antibodies in the breast and secretion into the breast milk.
Great. Next question. How many years does the immunization last in the body? I don't know which vaccine we're referring to, so you want to give a general answer?
It's hard to give a general answer because it really depends on the vaccine. If we're talking about COVID, I know a lot of people, that's a big question we get. I'll talk about COVID. So I think that's an area where we're still learning. What we have seen is that, we have data, I would say, out to about 8 or 9 or 10 months after people have started, getting COVID vaccination. So I'm aware of the data out for about 8 months since people have been fully vaccinated, getting, their 2 doses of mRNA, for example. And what we've seen is that, protection still remains pretty high against hospitalization and death through this period, and including, now that we're having variants like Delta and other variants emerging, protection against hospitalization remains pretty good. We've seen it kind of decline in some studies for some groups, such as older adults, 65 years and older, but in the general population, it's working pretty well. We've started to see some declines in protection against infection, whether that's asymptomatic infection or infections that have symptoms but not bad enough to get you in the hospital. We have started to see some declines in various groups for that. And that's, part of the reason why we now have booster dose recommendations, is to really kind of ward off any, illness that could be prevented through a booster vaccination.
Thank you. Next question. I have heard multiple concerns from those not getting the COVID vaccine because it's made with mRNA, and that the vaccine then alters your future immune responses to infectious disease and won't protect them due to the alteration of the immune system after getting the COVID vaccine. Can you address that concern?
Yeah, definitely. I mean, we've heard a lot of, misinformation around, mRNA vaccines and what they are. I mean, I think the thing to highlight is, mRNA vaccines, this might be our first mRNA, Pfizer and Moderna might be the first ones we have, licensed or authorized, but we've been studying these vaccines for 10 years now. There have been people that have been getting these in clinical trials for other diseases for a while now. So it's not something that's new to us in the science world. So we've had a chance to see what, some of the effects of these vaccines are in those clinical trials. But I think the other thing to emphasize is that, there's, mRNA might be a different technology by which we vaccinate, but it doesn't, the difference in the immune response, there's no evidence that there's any difference in how the immune response reacts. So when somebody gets an mRNA vaccine, injected into their muscle, the actual mRNA is so fragile that it breaks down very quickly. The half-life of mRNA, the actual mRNA that is injected as part of the vaccine, is the half-life is like a few hours, like 6 to 8 hours is what's been reported. After that, what the mRNA does though, and we have mRNA in our bodies, like a lot of it basically gives your body instructions for how to make a piece, to help trick the body into thinking they've been exposed to the virus. So there's no mRNA that stays in your body for long periods. It's so fragile that it breaks down over the course of hours. And then what is resulting from that is, it gives instructions to the body on how to trick the virus into thinking, that it's already seen the virus. So there's really nothing different about how the immune response reacts to a COVID vaccine as it would for other vaccines. It's just more about the mechanism by which it does that.
Very helpful. Thank you. I think we have time for probably like 2 more questions or so. Okay, let's see. When parents ask about getting the COVID booster shot for themselves to protect their young children, do you recommend they receive it?
Yeah, and I think there's, so there's a few kind of, I'll kind of briefly, I wish I'd put a slide in, but briefly kind of talk about our booster recommendations, because I think there has been some confusion given that, we started with a Pfizer recommendation, now we have it for all of them and mix and match and different things. So I'll just try to back up and give a little bit more information and then answer the question specifically. So there are, groups of people for which we have a kind of strong recommendation, like everybody in this group should get a booster shot. And that's people, 65 years and older. That's people of, 18 years and older who live in a long-term care facility, like a nursing home. And then people who are 50 to 64 years of age, so basically down to 50 years, who have underlying conditions. Medical conditions that put them at risk. Those people, they should get a booster shot. For other people, like those who are 18 years in age and older, who don't fall in those categories, but who are high risk either because of a medical condition or because of their occupational or institutional exposure. So healthcare workers, people who live or work in prisons, or, there's, I can put a link into the chat box of kind of who all we consider to be in that group, like frontline workers and things like that. We say that you are eligible for a booster shot and you may get a booster shot. You can, you don't have to. It's not, it's not a mandate or anything like that. But you can get the booster shot. So I think if there's anybody that's in those groups, they should definitely consider it. I would definitely consider it. I think what we've seen from the the data, the last time I looked, there were over 13 million people in the US who have already gotten a booster dose. And we're monitoring safety of that. Everything, there's nothing unexpected that's happening. People get the same kind of side effects, sore arm, maybe feel tired, have a headache, those kinds of things. They get the kind of same side effects that they would have gotten at their last dose. And we've seen that the immune response after booster dose is really good. So we expect that the booster dose would provide protection. So I think it's definitely something, if you're in one of those groups where we say you may get a booster dose, I would definitely, I think it's definitely something to consider, especially since, you have, I have a 1-year-old, I'm scheduled to get, I'm a healthcare worker in addition to working at CDC, a pediatrician, and I'm getting my booster dose on Monday. To me, it's important because I want to protect my son who's in daycare and who's 1 and can't get the vaccine any other way.
Thank you. And just a reminder, when I send out the email, I think it'll say it's coming from Vaccinate Your Family or Zoom. I'm not quite sure which one, but we do have this booster flowchart graphic that I'll send a link to or add it into the email, whichever one I could do. And I do think that that is helpful as well. And it also is for people who need the 3rd dose of either Pfizer or Moderna because their immune system is either very weakened or severe, moderately or severely weakened, as Dr. Mbaeyi was saying. Okay, next question is it recommended for pregnant and lactating women to get the booster COVID vaccine?
Yeah, so so for somebody who got an mRNA primary series, Pregnant women are, they're considered to be at increased risk for severe COVID. They're in that kind of category of people that I mentioned that have underlying conditions. So they're in the kind of, we recommend that they can get vaccinated, based on their individual benefits and risks kind of that they, kind of weigh and discuss, but they're kind of considered to have, for the purposes of that kind of recommendation, they're considered to have a condition that places them at increased risk. So they're eligible to get the booster shot. We do recommend for anybody who got Johnson & Johnson as their primary series to get a booster dose. So anybody 18 years and older who got Johnson & Johnson, they're recommended to get a booster dose regardless of their risks or what their job is or anything. So pregnant women would be recommended if they had gotten Johnson & Johnson as their first dose. Now, as I mentioned, and I forgot to circle back to this, for the booster dose, it can be any vaccine. So somebody who got Johnson & Johnson as their first dose, they can get Pfizer, they can get Moderna, as their booster dose, similar to somebody who got mRNA, we do have a kind of mix and match is allowed for the booster dose.
Great. Thank you so much. Before you all leave and go on with the rest of your days, I just want to ask 2 more quick polling questions. And this one question is, after participating in today's webinar, how do you feel about being a source of vaccine information for your WIC clients or WIC participants? So this is following up after being on this webinar and what you learned today. Okay, and let's just go on to the last question, Carly.
They're both on the screen, Jen.
Oh, okay, I'm sorry. Did not scroll down. The second question, in case anyone else didn't scroll down, is would you recommend this webinar to other WIC staff? And it's just yes or no. Okay. Thank you, everyone, for taking the time today. To our presenter, Dr. Sarah Mbaeyi, thank you so much. It was a great presentation. I hope everyone else agrees with me. And thank you to our partners at National WIC Association and USDA. We really value having you as partners and look forward to continue to working with you in the future. Thanks, everyone, and please keep the eye out for the email from me. Bye.
Thank you. Bye.